handsome nurse. Atar as child. Lee as news reporter. Tonight on Evening News, blah 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 blah. And also coming at you with Dad number 1.
Go.
And the world's best mom, Maria Maria.
Okay, here comes another set of contractions.
Remember to
Maria.
breathe. Push! Push!
Remember what the nurse taught
Remember
me.
what Austin nurse taught us? Where's the doctor? Push!
2 deep
Come
breaths.
on! 2 deep breaths. Have a relax.
And come on, Maria. Great. Push again.
On! Push!
Another deep
One more
breath.
push! Push hard! Harder! Harder!
Coming.
It's coming! It's coming!
Oh my gosh.
Oh my god! The miracle of life!
It's a beautiful boy.
Oh! Oh! It's disgusting! Oh!
One big
Push!
more
One more big push! Oh!
Oh. Look, you got a beautiful baby boy.
Oh my gosh.
What are you gonna name him?
Atar.
Oh.
The birth of a child. What a wonderful experience. As you can see from there, that was probably the greatest moment of their entire lives. But what happens if something goes wrong? Tonight, we will focus on watching Atar through some very troubled times. He's been admitted to VGH with your common flu, but we're going to use this opportunity to focus on his ADHD. So tonight's focus will be on the age-appropriate communication when dealing with a 9-year-old who has ADHD. Secondly, we will be dealing with the ability of nurses to deal with acting out. Acting out situations are very common with a child with ADHD, so we will be addressing this in a proper way and showing how to communicate therapeutically and professionally. Thirdly and lastly, we will focus our attention onto the interaction between the nurse and parents. As you see, Atar, young Atar, he has both loving and great parents who are with him along his journey. But as he's struggling with his ADHD, they might have some issues to address, and it might be beneficial to try to have a nurse look at their ways that they are communicating as well, and to help them along their way with young Atar. So let's go to the emergency room or the hospital room and find this young boy and film him.
Oh. Knock, knock.
Come in.
Hi, guys.
Hi, man.
How's it going today?
Who are you?
My name's Austin. I work here. I'm the nurse.
Are you lying to me?
No, I'm not.
Your nose is getting big.
My nose is.
Yeah, Mama told me you're Pinocchio.
I'm not a liar.
Yeah, you are.
What's your name?
I don't know. What's my name, Mom?
Be nice to the nurse.
My name is Atar.
Atar?
Yes.
Do you know where you are right now?
No.
Do you know why you're here?
Maybe.
Yeah? Did your mom take you down tonight?
I think I did something bad.
No, you didn't do anything bad at all.
I took the cookie
You're
from
just
the
a little
cookie
bit
jar.
sick is all.
No.
What's your favorite TV show?
Grey's Anatomy.
So, are you feeling sick at all, Atar? Stop hiding
Yes.
from me. I just
I'm
want
sick.
to take your temperature. Have you given him his medication today at all?
Yes.
You forgot. That's okay. We can get ahead of it. Atar, well, I brought you this coloring book that might make you feel a little bit better.
No, I don't want it.
Well, if you don't do it, it means I'm going to be coloring it all on all these pages with all these markers.
I wanted it.
Yeah,
My
go
coloring
away.
book.
Now, look what Atar drew. Isn't it beautiful? So I brought you guys into this room today to talk to you about Atar, obviously, and what's going on with him, and more about why he's here more than the flu. Are you guys willing to be educated on some stuff about ADHD.
What do you think?
Sure.
Do you think that's a good idea?
I think that's a lovely idea.
Okay, we'll listen to him.
Some constructive criticism, maybe?
Can you handle criticism?
Just kidding. Okay, first things first. The major thing that's important with any child or any adult or anybody suffering with ADHD is the importance of their medication regimen. So earlier we discussed that Maria had forgotten to give them medications this morning.
You did what?
You're the pup.
I don't know why. I don't know the problem. Maybe I don't need to know the problem. Like maybe you work and she works, or you know, there's all kinds of ways that it could be. But this
I got 2 jobs.
But this is
I got
really
2 jobs.
But this is your child, not you, and this is really, really important to stay for the safety of your child and well-being to take the medication. So do you guys have a schedule, a calendar?
No, we go with when we remember.
When you remember?
If we
do. You want to develop
it's pretty busy in our house.
Schedule?
How do we do that?
I can show you right now if you want on the...
We don't have a whiteboard at home.
Yeah, well, we have it in printout version as well.
What do we do next month?
Or I'll grab you the printout after we're done. But basically, it's establishing times with your schedules and developing a plan so we won't miss any more medications.
I'd be into that. Would you be into that? If it helps a little Atari, you know?
Yeah.
It's a shame to see him struggling in school.
Yeah,
it's
especially...
Really, it's heartbreaking. He's such a lovely young lad, you know? It's just... Sometimes he just can't focus. Yeah, I'd like to try and make him focus a bit more.
And how do you feel about that?
Well, you know, it's been hard because, you know, I provide everything. I put a roof over his head, you know, there's food on the table, and he just can't seem to behave.
Yeah,
you know,
you didn't really expect.
Where am I going wrong, right?
Yeah.
I don't want to punish the guy all the time. It's just,
well, there's definitely nothing
tough.
wrong with you, probably.
It's tough, you know. Bless his little heart, though. He's a lovely kid.
Yeah.
Yeah.
So other things that they suggest, like the medical background suggests, is to put a TAR in more day programs, fun kind of things, because obviously the little guy has a lot of effort or energy, right?
He does. He never runs it off. I swear. He's up there in his room, 12 o'clock at night, he's still running around. I can't stop him from things. Put him in bed, he's running around.
Yeah.
I think he runs on the ceiling sometimes.
So anyways, play therapy is, it really helps the kids, and to divert the situation when he's having a flare-up.
Yeah.
Like, when we were in the room earlier, I don't know if you recognize that as a flare-up, but...
Yeah, no, I could see this. He does that quite often, right? It's usually around, like, when if you ever try and tell him something to do, little Atari, he wants to do what he wants to do, right? And maybe it's good to give him some structure.
He's
like
at that age.
Or when he's bored.
Like Frisbee disc. It seems like a good thing that he would be into.
You know, from what I see, he's a completely normal kid.
Yeah,
and just a little bit too energized.
Oh, he's got so much energy. You should bless his little heart. You should see him on a little football field. He's got a little spot.
They've actually studies have shown that people with ADHD are amazing.
Oh, and his mind's sharp. He's always thinking of something, even if it's off topic. He's thinking about it though.
Yeah,
he is thinking about it.
So, just intervening as soon as the flare-ups start.
So you want me to throw this at him?
Medication, diet, and exercise, obviously. Okay. So sports is great if you got him in sports.
And what's this toy?
That's, I don't actually know. It comes with a package.
Oh, right.
Stress toy.
A stress cucumber. Sorry that your husband had to leave to work, but at least he came in for a little bit here. Are you guys really communicative at home?
I am. He's not.
Oh, yeah. So, well, hopefully you bring something home that improves for Atar's health, and obviously we're.
Oh my gosh! I'm trying to leave them alone. So what would I do now?
Well, first and foremost, like I said, like the medication is the most important. So, I mean, we can go see if he'll take some medication. And then as when we do this, we're gonna try to calm him down. Tar, get out of here! You're not supposed to be here. Tar. Anyways, so we get the medication. See the MAR right here? So this is kind of like our schedule. This is kind of like the schedule. Remember when we were talking about the schedules earlier? Well, here's one that you can take home. And then in the MAR right here, it tells how we do it is it says, this is your son's obviously. And it tells you which time to give the med. So anyways, here's the medicine. And we do our checks and whatever. And then, yeah, so I'd like to see how you administer the med for your son. You don't know how?
No.
Okay, so we do our checks. Fast forward. Now, can you show me how to do the meds?
No, because I wouldn't check a MAR. That's the thing, as a parent.
Oh, right.
I wouldn't check a MAR.
Right, okay.
I think
So all you would have to do is be like, so I've gone ahead and prepared his medication. I'm going to show you how to give it.
Okay. And we're also going to use some of the other therapeutic techniques that I showed you.
Yes, nurse.
Are you tired?
Yes.
Here, look what we got for you to bring home. We found it in the back room. What do you think?
It's cool.
Yeah? Ooh. Do you think your mom's going to get mad at you with that? I promised her you'd only play outside with it if I gave it to you.
Pinky promise.
You pinky promise? Okay. So I brought something for you to help you settle down a little bit.
What?
It's your medicine. The one that your mom gives you all the time. I'm just showing her how to properly give it. Is that okay?
Okay.
Okay. So this one is sub-Q. And it means it's gonna go mostly into his skin tissue, his dermal layers, his skin tissue. And for right here, I see like you have some marks from where you've given it before. We always want to give it 2 inches away from those marks and 2 inches away from the umbilicus or that belly button. So basically what you do is he's skinny, so we're going at a 45-degree angle. You're going to go in, you're going to let it go for 10 seconds while you pinch, and then let out. And then you're good. Of course, alcohol swab before. Don't be lazy on that, because risk for infection. How do you feel now?
It's done?
Yeah, you didn't even feel it?
Oh my god, no.
Yeah.
You're the best nurse ever.
Guess I should phone that couple again and see how they're doing with little Atar, because the file says so.
Ring, ring. Ring, ring.
Yep. You got Lee here.
Hi there, Mr. Adar. How are you doing today?
Yeah, I'm all right. I'm good. I'm just at work here. What do you want? Who's this?
Oh, did you have just a couple minutes to talk? It's Nurse Austin from the VCC hospital.
All right. Yeah. You're that bloke we talked to at the hospital, right? Yeah. All right. Yeah, the ADHD guy.
Well, yeah.
All right.
We could say that. I have a couple questions for you. How is the Atar doing since being in the hospital, and as well as did his flu clear up?
Oh yeah, his flu's fine. He's hop, skip, and jumping, behaving like every other 9-year-old kid. You know, he's out there playing football, doing all that.
Great.
And all that talk he gave about that therapeutic communication where you were going on about seemed to work. He's he's calmed right down. His grades have shot through the roof. He's doing really well. Teachers keep raving about him. They're asking me what happened. I'm like, well, I don't know, but it worked. That's about all I can say. He's doing a lot better.
Great, and you know what? That's why I do this job, is because I get to teach and help promote and prevent.
Yeah. Okay, well, I gotta go, all right? I'll see you later.
All right, nice talking to you. Bye.
Tonight was a great episode. What a heartfelt story. We got to the bottom of this one, and young Atar is thriving, as you can see. This is another great example of how communication, modern medicine, and everything comes together. We can have a great result for the family and everyone around us. I bid you farewell, have a good night, and watch us next week as we follow the family who claims they can speak to giraffes.
A genetic link.
Yeah.
Yeah, well, I was confused
Possibly.
at first. Well, that's a different story, though. I was really confused at first.
Yeah.
Turns out my fifth grandpa is from Rajasthan in India, so maybe that's the connection of why he's brown. I'm not really sure, but
Yeah.
yeah.
We're gonna edit that out, right?
Some other things you can do, and I'm gonna send you home with some things too. I brought some things. Some toy play therapy.
Oh, look at this! I had one of these when I was a kid. It's great.
Here's another one.
Still works. What the hell is that?
So, yeah. So, whenever it gets fired up.
A tar as child. That was so perverted.
One, go.
And the world's best mom, Maria, Maria.
Maria, Maria.
Maria, Maria.
Oh, this has been lovely.
And go. Off. And cameras are rolling.
The birth of a child can be a wonderful thing. But obviously, as you can see from... let's start again. I need to...
Ready?
Go.
Look, you got a beautiful baby boy.
Oh my gosh.
What are you gonna name him?
A tar.
Oh,
Oh,
beautiful.
perfect. Sounds like the sea.